All right, good morning, everyone. Welcome. I'm Ellen Bruno. I'm a cooperative extension specialist at Berkeley in the Department of Ag and Resource Economics. Thanks all for joining today. This is the first webinar in a new series called ARE Discussions. Webinars in this series will take place on the first and third Tuesday of each month, and we're going to host experts both within and outside the UC to discuss various issues facing California's ag and natural resource communities. This series is being organized by the UC Cooperative Extension Specialists in Agricultural and Resource Economics, spanning 3 campuses. We have Brittany Goodrich and Tina Saitone at UC Davis, Mehdi Namadi at UC Riverside, and myself. Our meetings will run for 1 hour. We're going to have 20 minutes of guided Q&A with each of our esteemed guests. And then we will have open Q&A with the audience at the end. So please submit your questions through the Q&A function at the bottom of your screen. These seminars are being recorded and they'll be available on our website, arediscussions.ucdavis.edu after the seminar. So we're kicking off the series with a webinar on COVID-19. First off, Brittany is going to lead a discussion with Joe Weill, an environmental economist and PhD candidate at UC Davis. He'll be discussing a paper that he co-authored titled Social Distancing Responses to COVID-19 Emergency Declarations Strongly Differentiated by Income. Then Tina will talk with 2 agricultural economists. We have Dan Scheitrum, an assistant professor at the University of Arizona, and Aleks Schaefer, an assistant professor at Michigan State University, both David grads as well. They'll discuss their joint paper on the transmission of COVID-19 from meatpacking facilities through rural communities, titled COVID-19 and Meatpacking, a Topographic Regression Approach. So with that, Brittany, please take it away.
All right, welcome everyone. So Joe, let's go ahead and just get right into it. So why don't you tell us a little bit about who the other researchers are that helped you with this study and how it came about?
Sure, let me share my screen.
Yep.
Here we go, can you see it?
Yes.
Yeah. So yeah, first, thanks very much for the invitation. It's great to be able to share this work. So this is an all Californian team with Matthew Stigler, who is a former PhD candidate from UC Davis and now a postdoc at Stanford. Mike Springborn, he's professor in environmental science and policy at UC Davis. And Olivier Dechaine, who is a professor in Santa Barbara. And so the initial idea for this project was, to be honest, completely different. We were more interested at first to study whether local policies had any impact on the transmission of COVID cases. So local policies, think about county level policies and city level policies. And we were very interested in that because in California, we saw several local governments that implemented policies, whereas in other parts of the US, it was more the far west actually, where nothing centralized was really being done. But as we looked more into the data, we realized also that a lot of the responses in mobility and cases seemed to be more driven by other economic factors rather than county level measures, and we decided to focus on that.
All right. Okay, so what can you tell us more about what the specific problem is that you're looking at and why it's important to Californians?
Yeah, so just to give a bit of context, again, we are still very much in the middle of this COVID-19 pandemic, and reducing mobility and staying at home is really the most obvious thing that can be done to first avoid getting infected, but also avoid infecting others. And just a quick look at the raw numbers. So this is like the solid line here is the raw data. So the number of cumulative deaths with respect to time. And the dotted lines here are different projections for what these numbers of deaths could look like by January 2021 under different scenarios. And we already have more than 200,000 deaths here in the US, which is a lot. Here I put a few historical comparisons. But these are just aggregate numbers, and it doesn't really tell us who is most impacted by this pandemic. And the question is who actually stays home more. And in particular, what we are looking at is how income influences who stays home. And looking at income is important because there is a lot of work that had already highlighted how poverty influences pre-existing health conditions and how these pre-existing health conditions can increase vulnerability to COVID-19. What we are really interested in this project is how income influences social distancing, and because we know that social distancing can reduce vulnerability to COVID-19.
All right. So let's get into the study. So what data did you use, and how did you go about looking at these problems?
So to look at mobility, there are various sources of information available, and we decided to use 3 of them to compare results that we obtained with different data sets and see if the results we had were really driven by any given source. But most of the data we have come from anonymized mobile phone GPS pings. So these are basically data sets that are shared by mobile phone companies or data aggregation companies, Google, for instance. And that will tell us every day who is moving in any given county or census tract in the US. And these data sets each provide different measures of mobility that we also compared. The first data set we used comes from a SafeGraph. It's a data set that was freely shared with us by SafeGraph, and we are really grateful for it. And this data set allows us to compute in each county or census tract in the US, what is the percentage of people who stay completely home on a given day. That means who are not seen leaving their house and coming back. They really stay home for the entire day. Google mobility data, that's another data set also from GPS pings that we used to look at visits to retail and recreation establishments. To be perfectly honest, we kind of gave up fairly quickly on the Google measures just because they are not as representative. They don't have really good coverage for all counties in the US, and in particular, they tend to focus on bigger and wealthier counties, which was not really what we were most interested in. But it tends to show similar results to what we obtained with the other measures. So we decided to keep it in this study. And the last data set that we use comes from yet another mobile phone data company, PlaceIQ. And this one is interesting because it does not just provide a measure of who stays home and who moves out on any given day, but more what is the average exposure of people to other individuals when they go out. So basically, if I go out and go to the supermarket, if no one is in the supermarket at the same time, it's not necessarily an issue. It doesn't mean that I'm more likely to be infected. But if a lot of people are doing like me and going to the same supermarket in the same day, then I'm much more likely to getting infected or to infect someone else. And this is what this data set will allow us to capture.
All right, interesting. So can you tell us more about what you found when you looked at these different data sets?
Yeah, so there are a lot of different ways to analyze these data sets, and there are various statistical methods. What we favored first was really to look at averages and just compute mobility averages based on income. So what we did was to separate the population into quintiles, or what we can call buckets, 5 different buckets based on neighborhood income. So the first quintile is the first bucket. This is made up of census tracts where the median person makes less than $21,500 per year. And this first quintile, you can see it on this picture depicted in dark blue or purple. And at the opposite end of the spectrum, you have the fifth quintile, which really depicts the census tracts that are much wealthier, with more than $40,000 per capita. So once we have these five groups of neighborhoods, then we can start looking at our measures of mobility in each of these five groups and how it varies with time. So here we have time shown on the x-axis here, starts in January of the year, and we end in a bit late April. And on the y-axis, we have the percentage of people who are staying completely at home on any given day. What is striking here is that when you look at the wealthier neighborhoods in yellow, the fifth quintile, you see that early on, before March, these people in these neighborhoods tended to stay at home relatively less than everyone else. They stayed at home, like less than 20% of people on most days would completely stay at home. Whereas in poorer neighborhoods, you already had 25, almost 30% of people and on some peak days that were already staying at home. However, sometime in March, and again, the World Health Organization declared COVID-19 a pandemic on March 11. Right around this time, you see that this ordering completely flips, and you see that the wealthier places in yellow, that people in these places tend to stay at home a lot more than places that are poorer. And again, everyone increased social distancing, or like on average, at each of these income groups, you see more people staying at home, but you see a much bigger increase of people staying at home in the wealthier areas. Of course, this is just looking at raw data and computing averages. Then there are a lot of things that could be driving this. So we decided to dive a little bit deeper into this, and we wanted to control for other things that were happening in different places, like these county level policies, city level policies, weather. We thought also that people could be responding to the date of an earlier case that had been declared in their county, etc. So we used other statistical approaches that are called the difference in differences or event studies to try to control for that, but the pictures remain the same. What's also striking is that this ordering that we see here for one mobility measure in one data set, we tend to see that whatever the data set that we use, whatever the mobility measure that we use. So here, for instance, when we look at, so this measure, maybe I forgot to introduce that. We looked at the median distance traveled in each, by people residing in each of these census tracts grouped by income. And we see that the people living in richer census tracts, richer neighborhoods, they tended to decrease how far they would travel much before everyone else, and they would decrease relatively more. Similarly, when we look at exposure to potential other infections or the infection of other people, we see that wealthier areas tended to decrease their exposure to others relatively more than all other census tracts, all other neighborhoods.
Joe, I have a quick question for you.
Yeah.
So I hadn't noticed this when I was looking at your paper before, but I see kind of like with the retail and recreation, there's almost like a jump in March. And do you think, is that because of kind of like the stocking up phenomenon that we saw from consumers? Is that what you all think?
Yeah, so yeah, this is a great question. And So there are two things that could be going on. So what you said regarding stocking up is definitely happening, and we've seen that using different data sets. We see that as the pandemic begins to unfold, there is really an increase in the visits to grocery shops in particular. People get a lot of food, a lot of toilet paper for some reasons. And so that's also interesting in itself, because if everyone goes to the grocery shops at the same time, it increases the risk of contagion. For this particular graph, however, we think that this has more to do with the way mobility is measured, because so this data was provided by Google, and Google had the strictest anonymization policies. So they really didn't want to share any data unless it was aggregated at a very high level. And so this is just relative to the baseline in January and February. So this jump is relative to whatever mobility measure was computed in early January and February. And of course, when you're in March, there are a lot of things that are different, and in a lot of places, weather is nicer, and all things are also going to impact this measure. But what's interesting for this measure is that you see that even relative to January and February, these are still the poorest counties that are decreasing mobility the most.
Interesting. Thanks for answering that.
Of course. Yeah, and so again, this is just very visual and computing averages, but we see the same patterns that hold when we try to build more complicated models that take into account other things that were going on at the same time, people responding to cases, early cases in the county where they live in, people responding to weather, etc. And what this graph shows here, so we have on the x-axis relative time, and this is time in days relative to the state emergency declaration. So whenever a state declared emergency declaration, we look at the relative change in mobility in counties that are located in different income groups. And we see that, again, the yellow dots here, the estimated effects are much bigger for the higher income groups than for the lower income groups. So this just shows that there was really a disproportionate increase, or like a relatively stronger increase in social distancing concentrated in the richer areas. And I'm not going to dive into the details for the other measures, but we tend to observe similar things when we look at other variables like the device exposure, retail and recreation, etc. Although when we look at this, we see that in many cases there seems to be movement in mobility before the state declared an emergency declaration. So, almost as if there were some kind of anticipation ahead of the policy.
Yeah, that makes sense. As we were all trying to figure out what was going on. Okay, so are you continuing this line of research, or are there any next steps that you want to tell us about? Yeah,
so we are actually going back now to our initial question, which was to look at the level of the impact of county level policies on mobility. So this is just to give you a sense of what are the counties in the US that declared an emergency at any point. This is data that was, part of this data was aggregated by the National Association of Counties, but we've spent a lot of time consolidating this data set with other measures that we collected by hand. And what is striking is that there are a lot of studies now that show that county level policies seem to have had a really strong impact on mobility and cases of COVID and mortality in the US. However, what we find is that when we specify the statistical model a bit differently, when we change a variable, when we look at a different way of measuring mobility, and when we do things that should not really impact the results, well, these models tell us completely different things. And basically, just to give an example, if you measure mobility a certain way, this is going to tell you that yes, county level policies have a clear impact on mobility, and hence could have been very helpful to curb the pandemic. But if you do a slight change to the outcome variable, if you do a slight modifications that should not really impact these findings, you find the opposite, which is that no, county level policies had no impact on mobility. And so this is much more of a methodological piece of work now that we are doing, and it's important because, again, we are already in the second wave, and we want to know if county level measures really impact mobility and the transmission of cases, and if so, which county measures are more likely to do so. But right now, with the preliminary results we have, we see that counties that declared an emergency or that declared a shelter in place are really systematically different from other counties. And we cannot rule out that these county level measures had small or no impact on mobility at all.
Interesting. So I guess we're going to have you back later on once you've finished up this study. Okay, so one of the things that obviously has been a big thing here in California is, we have a lot of essential farm workers that are being exposed to COVID and not being able to social distance. So can your study say anything about essential workers, and what kind of things have you thought about there?
Yeah, that's really a great question. And so there is a trade-off with the source of data that we decided to use. We focused on these measures of mobility based on anonymized GPS pings, which are great because they provide coverage of the entire United States, but they are not so great to dive into the specific mechanisms of why in some places we observe more people moving or sheltering in place. And so this is really what we think is the frontier for this type of questions. And we see that in poor areas, people reduce mobility less than others, and they stayed at home less. And this can be for many reasons. It could be because these people are exposed to different information sources, they have different political beliefs, and as you know, in the US, this pandemic has been heavily polarized across the political spectrum. It could also be that these people have different attitudes towards risk. These are all credible hypotheses. However, we think that the most likely explanation is that poor people are just extremely limited in their capacity to work from home. They cannot work like I'm doing right now, basically on a computer and afford to stay completely at home. So we think that this is most likely what is happening, and there is some work, most notably work that's going to be presented right now by Tina, Dan, and Aleks that show that this is most likely to be one of the driving explanations.
Yeah, that's definitely interesting. All right, thanks so much, Joe. Hang around so we can have the participants ask you questions later on. But now I think in the interest of time, we'll go ahead and turn it over to Tina, Dan, and Aleks to talk about their paper.
Thanks.
Thanks so much, Brittany, and thanks, Joe, for that great segue into our next presentation, which both Dan and Aleks are going to share some results out of a new paper that we worked on together on the meatpacking industry in the US and COVID-19. And so Dan and Aleks, thanks so much for participating in our inaugural ARE discussions webinar. And first, can you tell us a little bit about the genesis of this study and why you thought this topic was important enough to dedicate some of your capacity into?
Sure, I'll take the first crack at that. So really, what is the genesis of this study is like a way more existential question, I think, than maybe you intended. In that when we think about the work that we as academics do, or anybody, we see the COVID pandemic happening. People are sheltering in place. People are worried for themselves and for their loved ones, for maybe the future of the country and the economy. And so we just think, what can we do, right? So I applaud you guys for starting this webinar. This is a source of what can we do in these times to kind of share the information. When I think about myself as a dorky academic, the question, what can we do? The answer is math, right? And so that's kind of the attempt. This is, I guess, our attempt as people who can't treat sick people, don't have money to give to the people who are being impacted by this, don't have any kind of power to regulate. This is our method of understanding how this pandemic has impacted our society. So that's a big overarching answer, but the more specific answer to you, what's the genesis of this study? As all of you were early in the pandemic, March, April, May, I would sit at home and morning after morning, I would refresh this map that everyone has seen, right, of the COVID cases. And I would watch some of these counties stay either gray, meaning that the COVID hadn't arrived yet, or turned a little bit brown, meaning that there were some COVID cases, but it wasn't terrible. And then we've watched sort of with horror as some of these counties turned bluer and bluer and bluer, meaning that COVID transmission was really prevalent in those counties. So Dan, if you'll go to the next slide.
Yep.
So unless you've been asleep for the last 6 months, you'll probably have noticed that alongside just the disease impacts, there were some things that really stood out. So when you'd go to the grocery store, you noticed that either the food was completely missing or the prices for a lot of kind of staple foods, primarily meat, were going through the roof, right? And you've seen just kind of the widespread closures of the meat packing plants. So just in my following, this JBS plant, who's highlighted here in Greeley, Colorado, I believe was one of the first ones to close down. And we thought, oh no, what happens when these workers get sick? A few weeks later, we saw the Smithfield plant in Sioux Falls, South Dakota, where it turned out that workers had been reporting fever, had been feeling sick, and they were either advised or encouraged to go in and keep working. That led to massive transmission and massive outbreak of the disease, right? So if you'll go to the next slide, Dan. So that was important to me as an agricultural economist. It was also important to me as a person. So here are 3 selected news stories. The first is about the COVID cases at the Tyson plant in Finney County, Kansas. And so if you look at the map tomorrow, when you refresh that, you'll see that Finney County, Kansas is one of those places that's pretty blue. Finney County, Kansas happens to be the place that I went to high school. It's where my parents still live. So it was really important and scary for me. The second one, you look at there's a small Texas county with the most COVID cases per capita in the whole state. Well, that's where I grew up for the first 15 years of my life, and I still have several loved ones there. So that was scary. And then this last one, there's the Seaboard plant in Guyman, Oklahoma. That happens to be where my 85-year-old grandmother lives. So this was really close to home for me. It was something I was following very closely, and luckily for my what can I do about it, it felt like something that with my math, I knew how to answer the question of what is the impact of these large packing plants on COVID cases. So if you'll go to the next slide, Dan. just through another project that I was working with Tina on, because I try to work with her as much as possible because she's much smarter than me. I happened to know a data source where we could get the location of all of these large packing plants broken down by whether they're beef packing plants, pork packing plants, or chicken packing plants, with which we could match to that first data source that I showed you of the county slowly turning brown and then slowly turning blue over time to try to see what was the impact of the presence of one of those plants on transmission.
Yeah, and so I think you and Dan and I were all watching in the media, and in April 2020, many plants were shut down or operating at reduced capacity, and there was actually quite a lot of media outlets trying to quantify the impact, essentially trying to do what we did in this paper. To figure out what the increases in transmission rates were at the county level due to the meatpacking effect, if you will. And they quantified it between 75% and 400% higher than other counties that didn't have plants. And so can you guys tell us a little bit, is that consistent with what you found, or are your results different than that?
Yeah, so I can take that one. So after we matched up the locations of each of these meat packing plants to find out which county they were in, we were able to depict the spread of cases in each of these counties and compare the rate of infection in meatpacking counties versus all other counties. And so you can see that in counties that have a beef processing plant or a pork processing plant or chicken processing plant to a lesser extent, there's a much higher rate of spread in these counties compared to all other counties. And so I'll just switch the slide real quickly. The popular press investigations, it was two investigative journalist organizations who determined that it was 75 and 400% increased spread in these counties with meatpacking plants compared to all other counties. Well, what they had done is they looked at the infection rate in these counties with meatpacking plants and compared that to all other counties at a particular point in time. And so in one analysis, they looked at all counties. In the other analysis, they look at just rural counties. But there's a lot that's missed just by taking what's the disease incidence rate in counties with meatpacking plants versus all other counties, because this disease, as we heard earlier, marched across the country at different speeds. I remember that the earliest outbreaks were in Seattle and Colorado, New York City, San Francisco Bay Area. And so at any point in time, a county with a meatpacking plant, it may not have a case yet, or maybe it happened to get a case earlier than the rest of the counties in the country. So one of the things we did to control for that is we compare at the same evolutionary stage of the disease. So we look at the infection rate in these counties in terms of days since first infection. And so that's one of the main adjustments we make to see counties with a beef packing plant or pork or chicken, how quickly does the disease spread once it gets there compared to all other counties? How does the disease spread once it gets there that don't have a packing plant of this type? And then I can let Alex discuss the other adjustment we made to control for differences across counties.
Sure. So if you are a careful econometrician or dorky statistics nerd, which I guess I would describe probably Joe as the former, maybe not the latter, you are jumping out of your seats right now saying, you can't do these regressions, right? There are a whole bunch of reasons that meat packing plant counties are inherently different than counties that don't have these meat packing plants, right? So the composition, how many people are in the population, the demographic composition of those populations, what the states, we just can't compare Manhattan, New York to Manhattan, Kansas, right? There isn't a meat packing plant in Kansas, but or in Manhattan, Kansas, but that sounded nice in my mind. So what we do is we say, let's take a whole bunch of things that we could conceivably think of as one of those potential differences between a meat packing county and counties that don't have packing plants. And let's see how the inclusion or exclusion of those different variables impacts our estimates of the meat packing plant. So the way we've done this is a dorky statistical thing called a topographic regression, where we've divided these alternative or other variables into categories. So we say there are some things we just have to control for. And so that's what state they're in, because that's going to influence what the governor of the state, what the policymakers are telling them to do. Also, whether there's a meatpacking plant or not, right? We're going to control for county level policies. As Joe pointed out, that's a really important driver. We're going to control for the climate that these counties are in, because as the weather becomes hotter or not, people may be moving around differently, social distancing, interacting differently. So those are things we're going to control all the time. Then we're going to divide up our other stuff into different things like structural characteristics of the county, whether it's a farm county or a manufacturing county, the education level of the county. So maybe people who, as Joe pointed out, have higher educations and therefore have higher incomes are more or less able to social distance, which will affect transmission. Things like the health the health characterization of the county. So counties that have higher levels of obesity or other conditions that contribute to the impacts or spread of COVID may influence differently. So what we're going to do for each of those different categories, we're going to pick one of the variables that we think falls into that category, select one from each of those variables, run the regression, estimate the impacts, then do it again for another one of those variables for each of the categories. We do the thing for all of those categories, and then we do just kind of a statistical trick to pick what we think across all of those regressions is probably the most likely impact from the meatpacking plants.
So this figure right here tells you how each of those things impacts the mean estimate. So can you tell us kind of the punchline and what those mean estimates are, and so kind of how they differ from what the media was ultimately finding?
Dan, you want to go on that one?
Yeah. So after we control for all these factors, we find that after 60 days, we've got an impact of about 800% to 1,000% increased spread in counties that have beef or pork packing plants. So much more extreme than was being reported in the media with just the straightforward approach, comparing the average infection rate in counties that do and don't have meatpacking plants. And so there's a lot of factors that contribute to the spread of disease in meatpacking plants. And these have been identified in prior literature. The low temperature in the packing plants and the humidity conditions, metallic surfaces, as well as the amount of water they use and spraying it around. The congregate work setting. So they work close together side by side and have break areas that are close together. They also where the workers will commute with each other to work and back. This work is physical in nature. There's heavy breathing as you're breaking down an animal, and so there's a lot of there could be virus shed in that case from an infected person, and it may make mask wearing difficult if that's an option at the time. And also the immigration status of workers. It may make them less inclined to accept relief packages if they're worried that accepting the CARES package may compromise their immigration status, or they just don't feel that they are eligible. They may then feel compelled to work in that case because they have no alternative. It's either show up to work and earn a paycheck or don't. And so these are the contributory factors that we identified in the meatpacking scenario. And then if you look at this graph, it may be hard to see given the size, but even within the meatpacking sector, we see much more rapid spread in the beef and pork packing plants than chicken. And that we believe is because chicken plants are much more automated, they're a lot more mechanized, and there's more space between employees in chicken plants than there are beef and pork. And so to the extent that we could generalize this result to other manufacturing, it depends on the degree to which the employees work close together, how automated a factory may be, the amount of water and spraying that they do in that facility. But it's definitely idiosyncratic to the production practices in the factory.
Yeah, definitely. So far we've really focused on epidemiological impacts, right? So increased infection rates in counties with meatpacking operation. You also attempted to quantify these impacts in monetary terms, right? Can you tell us a little bit about those estimates?
Right. Yeah. So this is something I guess we need to clarify on a few fronts. The first is what we're attempting to quantify here are the impacts of those of that increased mortality and morbidity only. So we're not looking at other things, rising meat prices, falling meat prices for farmers, any of those other impacts that are the result of these transmission in the packing plants. We're just looking at the mortality and the morbidity. And you may ask, isn't it sort of cold-hearted to try to quantify these deaths, these infections in monetary terms, which I'm about to explain how we did that. And to a certain extent, I think the answer is honestly yes. It's a little bit cold-hearted for us to construct what we're calling the value of these people's lives. At the same time, I would argue, and I think many economists would argue, that this is a really important thing to do from the perspective of the policymaker. So these guys have a fixed budget and they're trying to make decisions of how do we address this problem versus this problem. And it is really hard for a policymaker to say, how do I balance this many infections versus the price of meat for consumers, a lower price of meat for consumers. And so this is the first attempt at helping policymakers make that decision, is trying to put an apples to apples comparison of the values that we're calculating versus those potential values either up or down the food supply chain. So the way we did that, Dan has already shared with you the impacts we've calculated in terms of the number of infections caused. We're going to translate that now into our best guess as to what that means for county level deaths. And the way we're going to do that is we're taking current case fatality rates in the US, which means of the number of cases we've gotten, what percentage of those cases resulted in death. At the time we did this study, that was 3.2%. So for every one of the cases we've estimated here, we're going to multiply that number by 3.2% to get the deaths we've estimated here. Then we're going to take that into economic impacts. And the way we're going to do that is to be as conservative as possible. So not calculating any of the emotional angst that people are feeling, both those that get sick nor their loved ones, which is really important, but it's not something we're looking at here. So the way we're going to do that is we're going to say a good guess for the cost of these infections is for the people that don't die. We're going to ignore kind of any of those ongoing health impacts maybe down the road. We're just going to look at that window. People say it's about 14 days in which they are really immobilized on average, right? And so we're going to calculate that window as the lost income or the amount of time that they were sick and weren't able to kind of do anything other than manage their lives due to the disease. And so we're going to value that window of time in which they were not able to do other things in terms of the value of their labor. So we're going to take to be as conservative as possible, the minimum wage in the US, going to multiply it by that lost time for all of those cases that didn't die. And so those are that measure of the lost wages and productivity from the infections caused. we're going to do the exact same approach for the deaths, where we say, all right, at this point, this person has died. They are no longer able to benefit from their wages. Their families aren't able to benefit from their wages. Their counties aren't able to benefit from their wages. So we're going to calculate our best guess as to that lost value, the statistical value resulting from the time they died to when they would have naturally or otherwise died. We're going to multiply that value by the number of deaths that were caused to arrive at those death costs or morbidity costs. We add those suckers up, and that's our best conservative estimate of kind of an apples to apples comparison of the deaths or the disease costs, which you can then balance with the other costs that policymakers will be thinking about.
Yeah, and that's obviously a huge total economic cost, and certainly a very personal one for these workers as well. Can you tell us a little bit, these are obviously essential workers. Can you tell us a little more about like the general demographic characteristics of the meatpacking plant workforce? Because I think that really ties right back into some of the results that Joe was talking about earlier in the webinar.
Yeah, so it's important to note that this economic cost, we estimate this $2.5 billion, that falls, pretty concentrated in these households that, are suffering illness or loss of life and the communities that they live in. So it's a very concentrated economic cost, whereas the benefit of maintaining supply is shared by everyone in the country. Everyone benefits slightly from availability of beef or pork or chicken, but these costs are highly concentrated. And so the demographics of the meatpacking workers, it's largely male, 58% male, and largely foreign born. So over half are from countries outside the US. Largely they're Black or Hispanic and have education attainment of high school or less than high school. That's predominantly who's working in these meatpacking plants. And so this coincides with Joakim's research that these lower income, more disadvantaged communities, they can't socially distance. They can't, butcher an animal from home. They have to go into work to earn their paycheck. They're essential workers, and really they're almost super essential because of the Defense Production Act, which compelled the plants to stay open. And so this is just illustrates how this concentrated impact fell on this disadvantaged community. And on top of that, this minority population seems to be adversely affected by this disease on top of that. So this is who's bearing the burden of the economic costs.
Yeah, thank you guys so much for sharing us. With about 10 minutes to go, I wanted to turn the moderator role over to Mehdi, who's going to be Q&A for both of our groups of panelists.
Thank you all. This is a really great and interesting work. We have some questions from the audience. I'm going to start with the first question, which is for all of you. Do you have any policy recommendations based on what you have found? Starting with Joe and then going to Alex and Dan.
Yeah, I mean, even though there is clearly always more research that is needed to try to disentangle the different roles that can explain the results, I think that both the work that was just presented and my work, they tend to show that poor individuals that are at much higher risk of infection from COVID-19. And so one of the big questions that is going to come up in the coming weeks or months is that of vaccines allocation. Vaccines are going to become available, hopefully soon, although it may be less soon that we would want to, but they are very unlikely to become widely available early on. The production of the vaccines will take some time to ramp up. And so there will initially not be enough vaccines for everybody. The question is, how do we distribute these vaccines? And I think a major implication of works like the ones we presented today is that we should strongly consider allocating and giving these vaccines to essential workers and poor individuals first, because they are already much more vulnerable to COVID-19 when they get it. And based on what we showed today, they are also more likely to get it in the first place.
How about the second work and by Dan and Alex? Do you have any policy recommendations based on what you have found?
Yeah, I would say the policy recommendation here is there was concern about the food supply. Will the food system, stand up to this huge shock? And there's been a lot of disruption with, people aren't eating at restaurants or hotels. And there's been, unavailability of certain products in grocery stores for some time period. But for the most part, that's all been adjusted and our food system seems to be operating just fine. But what needs to be considered are, these workers in these settings that generate high exposure. And so worker protections and specifically accommodations to allow workers that may feel sick or would otherwise want to stay out of the workplace for disease concerns, even if they're concerned about their immigration status or whatever, need to be reassured that they can get some relief without jeopardizing their status in the country in order to keep the disease spread to a minimum.
That's great. And here is a question from audience for Alex and Dan. We are seeing increasing cases again, and do you know or do you have information on what has been done by the firms to prevent reoccurrence? Should we expect the same thing in the winter? That's number of cases are growing.
I can talk a little bit about that. So I know you can. I wish I'd pulled up the CDC, but there are CDC documents which have shown best practices. So social distancing among workers. They've put up plexiglass in many of these packing plants. They're rotating their shifts differently so that they're not all concentrated at the same time. Some of them have invested in some improved air filtration systems so that the virus isn't just sitting around in the air. And I believe that they've also experimented with in some of these packing plants ultraviolet light, which is supposed to kill the. I'm not a health expert, but supposed to immobilize the virus when it's in the air. So even if you breathe that thing in afterwards, maybe you don't get infected. So that's as much as I know about that. When you ask if there will be a recurrence, maybe Joakim's forecasts were the best evidence we have there. I guess one point that I would put forward there is that yes, there have been huge costs to these workers in these plants, but at the same time, understanding how that spread has happened in these packing plant counties where we've really spread up the rate of the disease probably helps us make better decisions about those counties that don't have the packing plants, just because of the fact that the presence of the packing plants has kind of sped up the progress of this thing. So we're able to use the kind of transmission evidence from where those are now to make decisions for counties that are maybe not that far along on that epidemiological process.
And so there's another vector of concern that I don't know if it's being addressed or not, and I don't know that the packing plants can address it, but it's the where and how the workforce lives when they're not at work. Do they live together in close communities, and do they commute to work? So if they're not addressing that, that's something that they should consider.
Yeah. Here is a question for Joe, and they're asking about, have you looked into the type of work that the people in the different quintiles do? It's easier to understand those in the first quintile, why they have to go out more, and the fifth quintile. But how about the second and third and fourth? Do you have any information on what's going on in there?
Yeah, no, that's a good question. And based on the definitions of our quintiles, remember that there will be poorer and wealthier individuals at in each quintile, but we will have more wealthy individuals in the top quintile and less poor individuals in the top quintile. But within each bucket, there is still some variability of the income of the underlying population. And there's other work that shows that basically the richer you are, the more you're likely to be working from home. And it's not just you work from home above a certain level or you don't. It's really at each income level there you have a certain probability of being able to work from home, and this probability increases as you get richer. And so people who are in these medium income quintiles, so second, third, and fourth, first they are a bit more likely to have medium income levels than in these extreme quintiles. But also they have like more of an average probability of being able to keep working, but work from home. And so this is why we think they appear at these medium levels of mobility or social distancing.
Perfect, thank you. Another question for Dan and Alex. How do you share your results in a non-political way, given there was a great pressure for this industry to stay open, including pressure from the local public health officials? For example, this question is coming from Don from Colorado and GBS. They had a high pressure to stay open.
Yeah, so, you know, regardless of what your objective is or what your preferred outcome is, this is important to know. And so how to avoid being political, I think it's important just to be matter of fact and present what we found and how we found it and what it means and what the concerns are. And even if you are desperately hoping for this plant to stay open and in operation, or hoping that it shuts down and everyone can avoid work for a while, it's important to know what the trade-offs are and what the realistic outlook is.
Perfect. Yeah. And then, given we are getting close to the to 11, I have one last question for Joe, and then I turn it over to Ellen. Have you looked back to the data and see what's going on in the last few months, given there are new information coming out?
Yeah, so we are doing that right now. It's very much in progress. We do see that after April, in many places there's a decline in social distancing. So a lot of people are starting to go outside more, and we see this in most places, but a bit more in wealthier areas, at least in some states. But yeah, this is still a work in progress.
Yeah, thank you. Perfect.
Thank you so much, Joe, Alex, and Dan. I just want to share quickly about our next webinar, which will take place on Tuesday, October 20th on wildfires in California, fire ecology and the economics of suppression. We have a fire ecologist, Scott Stevens from UC Berkeley, and a wildfire economist, Jude Baham from Colorado State. Don't forget to register in advance. Please visit our website for more information, arediscussions.ucdavis.edu. Thank you all so much for joining. Hope to see you next time.